$4,800 in America, $650 in Turkey. Same implant, same brand, same 10-year survival rate. Today we're breaking down why. Before we go further, a quick note. This video is for informational and educational purposes only. We are not medical professionals, and nothing here is medical advice. Always consult a qualified healthcare provider before making any medical decision. Every price and statistic in this video comes from government and peer-reviewed sources: the American Dental Association, the Centers for Medicare and Medicaid Services, the OECD, the World Health Organization, and Joint Commission International. No clinic is being promoted, no patient story is dramatized, just the numbers. Let's start with the number that surprises most Americans. According to the American Dental Association's 2024 survey of dental fees, a single dental implant in the United States, that includes the implant post, the abutment, and the crown, averages $4,800. The typical range runs from $3,000 on the low end to $6,000 on the high end. Full mouth reconstruction, the all-on-4 or all-on-6 procedures, averages $34,000 in the US and can climb past $50,000 in major metro areas. Now, the same single implant in Turkey. Package price in a JCI-accredited Istanbul or Antalya clinic, $650. The range runs from $400 to $1,200. Full mouth per arch averages $5,500. That's an 86% savings on a single implant. $28,500 saved on a full mouth case. And here is the critical detail. Those Turkey prices typically include consultation, a 3D CBCT scan, the implant itself, the abutment, the zirconia crown, and often hotel accommodation and airport transfer. It's a package, not a bait price. So why Turkey? Why not Mexico? Why not Thailand? Why not Hungary? The data tells a specific story. According to the Turkish Statistical Institute, Turkey received approximately 1.5 million international health tourists in 2023, generating over $2.3 billion in revenue. Dental care ranked among the top 3 procedure categories. This is not a fringe market, it is national infrastructure. Turkey has 34 Joint Commission International accredited healthcare facilities as of 2024, one of the highest counts anywhere in Europe. For context, JCI accreditation is the same gold standard international hospital certification recognized by the US Department of State and major American insurers. Istanbul alone hosts over 1,500 private dental clinics, and more than 250 actively serve international patients in English, German, and Arabic. The Turkish dental education system is a 5-year university program, curricula aligned with European Union dental directives, with mandatory continuing education for license renewal. Turkey graduates over 3,000 dentists per year. Now, why are the prices so much lower? It is not one factor, it is 4. First, currency. The Turkish lira has depreciated significantly against the US dollar since 2018, compressing local costs measured in dollars. Second, real estate. Clinic rent in even premium Istanbul districts runs a fraction of comparable space in Manhattan, Los Angeles, or Boston. Third, malpractice insurance. Premiums for Turkish dental practitioners are a small fraction of US averages. Fourth, no insurance billing layer. There are no in-network negotiations, no claims departments, no prior authorizations. The clinic quotes a price, the patient pays it, and that is the transaction. Geography matters too. Istanbul is a 3-hour flight from most of Europe and a single connection flight from the US East Coast. The Republic of Türkiye Ministry of Health operates a dedicated health tourism department that authorizes and audits clinics serving foreign patients. That authorization list is publicly searchable on the ministry's website. It is not a marketing claim. It's a government registry, and clinics can be removed for noncompliance. One more piece of context. The implant brands used in these Turkish clinics, Straumann, Nobel Biocare, Ostom, MIS, are the exact same brands used in high-end American practices. The hardware is identical. The surgical protocols follow the same International Team for Implantology guidelines. Crown and prosthetic lab labor in Istanbul averages roughly 1/5 of equivalent US lab fees per OECD service cost benchmarks. The Turkish Dental Association, TDB, also maintains a public dentist registry that complements the Ministry of Health authorization list. Those costs, not quality, drive the price gap. But before you book a flight, there's a lot that can go wrong if you pick the wrong clinic, skip the right questions, or underestimate recovery time. We put together a free medical tourism checklist, the exact questions to ask, the documents to request, the red flags to watch for, and how to coordinate your U.S. dentist for follow-up. The link is in the description below. Now back to the numbers. And the one question everyone asks when they hear an 86% price difference, is the quality really the same? Let's go head-to-head. Implant brand. In top U.S. practices, Straumann, Nobel Biocare. In top Turkish clinics, Straumann, Nobel Biocare. Identical. 10-year survival rate. Here's how the published numbers actually break down. U.S. private practice meta-analyses report a 95 to 98% 10-year survival rate. JCI-accredited Turkish centers report 92 to 97% in published case series. Those bands overlap, and the difference falls within statistical noise according to the 2022 and 2023 Journal of Clinical Periodontology meta-analyses. There is no clinically significant outcome difference between qualified providers in the two countries when identical implant brands are used. Material parity. Implant posts use the same medical-grade titanium alloys, grade 4 commercially pure, or grade 5 Ti6Al4 Fold, sourced from the same global suppliers and held to the same ISO 5832 metallurgical standards. The hardware is metallurgically identical. That's peer-reviewed, not marketing. Crown material, zirconia or porcelain fused to metal in both markets. Same labs, often the same suppliers, Ivoclar 3M, Dentsply Sirona. Bone grafting and sinus lift procedures, when needed, use the same biomaterials in both markets. BioOss, Geislich brand collagen membranes, and follow the same Misch and Brandemark surgical protocols. Sedation options are comparable. IV sedation is widely available in larger Turkish dental centers. General anesthesia is offered for full mouth cases in hospital-affiliated facilities. Imaging. Cone beam CT scans are routine in both countries. In fact, leading Turkish clinics often run newer generation CBCT units than the average U.S. private practice, because the equipment was purchased recently as the medical tourism market grew. Digital workflow. Intraoral scanners, Trios, Itero, Medit, and chairside CAD/CAM mills like Surek are now standard in top Turkish clinics, enabling same-day temporary crowns. Sterilization. Class B autoclaves with traceable cycle logs are required under Türkiye Ministry of Health authorization, the same standard required by the European Union. Accreditation. In the U.S., a dentist is licensed by the American Dental Association and the State Dental Board. In Turkey, a health tourism authorized clinic carries Joint Commission International Accreditation plus Türkiye Ministry of Health authorization, a two-layer oversight that many American clinics do not match. Warranty. A typical U.S. implant carries a 5 to 10-year warranty from the manufacturer. A reputable Turkish clinic carries the same manufacturer warranty, plus often a clinic-level guarantee covering the prosthetic component. Revision cost. This one matters and rarely gets discussed. A single failed implant retreatment in the U.S. runs $2,000 to $4,000 in additional out-of-pocket cost. The same revision at the originating Turkish clinic is often included in a clinic-level guarantee or charged at $300 to $500 plus a return trip. Complication rate. Peri-implantitis, the most common long-term implant complication, has a 5-year incidence in the 8 to 20% range globally per the Journal of Clinical Periodontology, with no documented country of origin effect when adjusted for hygiene compliance and smoking. So where's the real difference? It is not in the implant, it is not in the training, it is in the overhead. U.S. practices carry rent, staffing, billing teams, and malpractice premiums that add $2,000 to $3,000 per procedure in overhead. Turkish clinics simply do not. That is the entire story. And one more thing worth knowing. Medicare does not cover routine dental implants. According to the CMS Medicare coverage database, roughly 68 million U.S. adults had no dental insurance in 2023. For most Americans, an implant is 100% out of pocket. That is the primary driver of dental tourism. Here's what the pathway actually looks like. 5 steps. Step 1. Remote consultation. You book a video call with a Turkish dentist, typically free. You send existing panoramic X-rays or a CT scan. The dentist reviews, asks questions, and gives a preliminary opinion. Allow a 2-week window for the full consultation cycle. Initial call, scan upload, dentist review, written response. Call itself runs 30 to 60 minutes. Always get the consulting dentist's full name and license number, and verify it against the Türkiye Ministry of Health Authorization Registry. If the clinic resists giving you a name, walk away. Step 2. Treatment plan and quote. The clinic performs a detailed 3D CBCT review of your scans, builds a surgical plan, and sends you a written quote with a fixed package price. You should receive an itemized list, implant brand, abutment type, crown material, number of appointments, hotel nights included, and what is excluded. If the quote is vague, that's a red flag. Ask specifically for CDT codes, the same codes U.S. dentists use. Get the quote in writing in English on clinic letterhead. Step 3. Travel booking. Once you accept the plan, the clinic typically coordinates hotel and airport transfer. You book your own flight. U.S. passport holders receive 90-day visa-free entry to Turkey, so no visa application is required for a standard medical trip. Round-trip economy from the U.S. East Coast to Istanbul typically runs $800 to $1,200. From the West Coast, $1,100 to $1,600. Hotel budget for a 3 to 4-star property within walking distance of the clinic district runs $80 to $150 per night. Pack prescription medications in original bottles, copies of medical records, your existing dental X-rays, and the contact information of your local U.S. dentist. A travel companion is recommended for recovery support. Step 4. Procedure week. Day 1 is in-person exam, panoramic and 3D CBCT scan, and treatment confirmation. Surgical placement happens day 1 or day 2 depending on case complexity. After the implant post is placed, osseointegration, the biological fusion of bone to titanium, takes 3 to 6 months according to standard Brainmark protocol. That waiting period is biology, not bureaucracy. It is the same in every country. So most cases require 2 trips. Trip 1, 5 to 7 days for surgery and healing abutment. Trip 2, 3 to 6 months later, 3 to 5 days for final crown placement. Total trip days, both visits combined, 8 to 12 days. If a sinus lift is part of the surgery, expect a 48 to 72-hour no-fly window after the procedure. The surgeon must clear you before departure. Resist the temptation to combine recovery with heavy sightseeing. Walking around Old Istanbul is fine. Long bus tours and dusty environments are not. Infection risk during early healing is real. Step 5. Remote follow-up. Reputable clinics do 6-month remote check-ins by video and provide an international emergency contact. Your treatment records, surgical notes, implant lot numbers, prosthetic specifications should be sent to you in English. Your local U.S. general dentist handles routine cleanings and emergency care. Coordinate this up front. Bring your local dentist into the conversation before you travel, not after. On insurance reimbursement. U.S. dental insurance generally will not reimburse care performed abroad, but health savings account and flexible spending account funds can typically be applied with proper documentation. Verify with your plan administrator before you travel. Now the bottom line trip math. Total all-in cost, flights, hotels, both trips, surgery, prosthetic, ground transport, for a single implant runs roughly $2,500 to $4,000 versus the $4,800 U.S. average. For full mouth reconstruction, total all-in is typically $8,000 to $10,000 versus the $34,000 U.S. average. Net savings on a full mouth case after every travel cost is counted, $20,000 to $26,000. That's the pathway. It is not a vacation with a side of surgery. It is a structured medical trip with real recovery expectations and real follow-up requirements. So what's the honest takeaway? The savings are real. The implant brands are identical. The 10-year survival rates are statistically the same. The accreditation framework, JCI plus Turkish Ministry of Health, is publicly auditable. The patient pathway is well established for 1.5 million people a year. This is not a loophole. It is a legitimate option. That said, it is not for everyone. If you have complex medical conditions like uncontrolled diabetes, autoimmune disease, or a history of severe bone loss, an in-person U.S. workup should come first. If you cannot travel, if you do not have a local U.S. dentist willing to coordinate follow-up, or if you cannot take the time off work, traditional domestic care may still be the right answer for you. Use the checklist in the description, vet the clinic, verify the dentist's license, ask for the names of the implant systems, and confirm them against the manufacturer's authorized provider list. The point of this video is not to tell you what to do, it is to make sure you know the numbers and the verification steps before you decide. Because in American healthcare, the biggest risk is usually not knowing that a cheaper, equally good option even exists. You shouldn't have to go broke to feel whole.